Federal data shows the odds of getting hurt on the job in the ER are pretty high. Those injuries coming from violent patients, many with mental illness, maybe too much stress or under the influence of drugs and alcohol. Medical providers say you likely can't find an ER nurse who hasn't witnessed or been a victim of an assault. Here's Chief Investigative Reporter Jonathan Deans with what medical providers are calling an epidemic of violence.
Scrapes, bites, bloody noses.
I was assaulted by a patient.
I'm going to cut you, I'm going to kill you.
He said, I'm going to beat the crap out of you.
4 emergency healthcare providers, all of them attacked on the job. Shoshana Weiner and Benny MATHEW are ER nurses in New York City. Both say workplace violence is frequent and comes with the job.
On a weekly basis, someone experiences some kind of physical violation from the patient.
He grabbed my hair from behind, yanked my head backwards, flipped my chair backwards, started punching me. One of the other providers had to pull her off of me.
She says the patient became upset after Weiner recommended a psych evaluation, so the patient attacked her. Weiner pressed charges. She suffered injuries to the back of the head and swelling to the face. Weiner says she underwent physical therapy for weeks and missed several days of work. As for MATHEW, he survived a similar attack.
I was, entering his information in the monitor and started punching me all over my head, my face.
We found examples of ER violence across the country, hospital guests posting potentially violent situations on social media, like this man attacking staff with part of his hospital bed, or this attack in a Las Vegas ER waiting room, and this melee at a hospital in Brooklyn, and another fight in a New Jersey waiting room. According to the Bureau of Labor Statistics, for private hospital employees, the workplace violence injury rate in Connecticut was 5 times the national rate of all other industries, nearly 7 times in New Jersey and 8 times in New York. And a 2018 survey of more than 3,000 ER doctors found 47% had been assaulted. 97% of the time, the assailant was a patient.
The violence that occurs on a daily basis. It's known as the dirty little secret in healthcare.
Edward VANWAGNER is a registered nurse, paramedic, and firefighter. He's also an instructor for DT4 EMS, a company that teaches defensive tactics to emergency responders.
The vast majority of assaults that occur in the healthcare setting are non-lethal in nature, but you don't have to be killed to be changed forever.
On this day, VANWAGNER and Callie Stevens are training EMTs. The very same defensive techniques they teach nurses.
So that when they face it in the field, they're familiar with it and they know how to respond in a reasonable manner.
You can protect people or at least reduce the risk of people who are the caregivers. They're the good guys.
Connecticut Congressman Joe Courtney says even with rising numbers, workplace violence at hospitals is underreported. He sponsored a bill that passed the House and is now in the Senate, requiring hospitals to create workplace prevention plans, collect data reflecting workplace violence, and require the Occupational Safety and Health Administration to collect that data, none of which, according to Courtney, is currently required by hospitals.
If you slip and fall as an employee in a hospital, that's reported. There's data collected on it. But if somebody punches you out in a hospital, that data is not collected by the OSHA system.
These nurses say the help they need is an emergency. All too often, they are becoming the patients.
Okay, the patient didn't know what they were doing. It's okay for them to do it. It's not.
Nobody should be being assaulted at their workplace, and healthcare workers are not immune to that right.
The Greater New York Hospital Association says their member hospitals are constantly improving strategies to address workplace violence, emphasizing employee health and safety, empowering frontline workers to participate in developing and implementing mitigation strategies. Congressman Courtney says he expects his bill to pass the Senate with bipartisan support. Jonathan Deans, News 4.
Thank you for watching this video from NBC4 New York. You can subscribe by tapping the button below me, and on the left you can see our latest updates, investigations, and digital exclusives. We'll see you next time.